In Chapter 10, we'll see three different either disorders or family of disorders that are related to either sex or gender. These are three different families within the DSM, separated by more than 100 pages. So don't consider them to be related, but three disorders that were placed in the same chapter for convenience and related to a sexual or gender loosely connected theme. I thought it would be desirable to introduce ourselves to a few of the major sexologists before we get into the rest of the content of our chapter. So I focused on three, one much more distant in the past, Richard von Krafft-Ebing, as well as the more modern Alfred Kinsey, and the even more modern William Masters and Virginia Johnson. Of all the early sexologists, Richard von Krafft-Ebing was by far the most influential. Now, not necessarily the most beneficial to our knowledge or sexuality, but the most influential. His text, Psychopathologia Sexualis, which is a name you do not need to know, discussed deviance. It was the go-to manual used by judges and medical doctors in topics that he considered to be sexually deviant. He thought that masturbation caused virtually all sexual problems. Modern thought that masturbation is healthy psychologically and physiologically, but again, Ebing thought that it was basically the root of all evils. We should also associate him with the terms sadism and masochism, or masochism if you prefer. He first termed them. I would be surprised if you ever heard the name von Krafft-Ebing outside of a college course, but many people who have never even attended college are familiar with Alfred Kinsey, in no small part to the movie that he was portrayed by Liam Neeson, and quite well, by the way. According to the U.S. government, his work was obscene and immoral and put the country at risk for communist takeover, and I kid you not, that's what the government policy was. Back in the late 40s and through the 50s, we were extremely concerned with communism and that we would be overrun with the Reds. And I can remember as a youth going and doing the duck and cover drills in case we were attacked with nuclear weapons by Russia. So what was Alfred Kinsey up to? Simply the survey methods, more specifically interviews. Beginning in 1948, he and his team conducted an amazing number of interviews, 16,000 plus, which gave us much foundational knowledge in the area of sexuality in terms of particularly behaviors that we did not know. He also talked about sexual orientation and created the famous and used Kinsey scale of sexual orientation. In the bottom I put a trailer for the movie that I mentioned that had Liam Neeson. Watch it. It gives you a flavor of it, and it's definitely worth watching. We'll first consider sexual dysfunctions. They're clinically significant, quoted from the DSM, inability to respond sexually and or to experience pleasure. If it's simply due to a lack of sufficient stimulation, it's not a disorder. Some may be lifelong, and they can either be highly situational or generalized to many situations. The therapist should consider partner factors, relationship factors, individual factors, and cultural or religious factors when undergoing treatment for the individual. Let's now consider a family of disorder called the sexual dysfunctions. For most of them, for diagnosis, the issue has to be present 3/4 of the time or more. It also has to be present for 6 months or longer, or cause significant distress or impairment. The treatments may be behavioral or cognitive behavioral therapy or biological, depending on the disorder and the particular cause of that disorder. Dysfunction classes vary for men and for women, but often there's a comparable one in each for each sex. Erectile disorder, premature ejaculation, delayed ejaculation, male hypoactive sexual desire disorder. In women, female orgasmic disorder, female sexual interest/arousal disorder, and genitopelvic pain, or it's called penetration disorder, but your general practitioner would probably use the term vaginismus. So again, for a condition, say vaginismus, it could be related to a psychological trauma. It could be purely biological. So the treatment for this disorder or any disorder would depend on the particular cause. For some conditions, such as erectile disorder, medication is often the only treatment that's needed. So again, different disorders, different causes, different treatments. Let's now consider the second family of disorders of the chapter, the paraphilias. They all involve intense sexual interest, and it would not involve a mature consenting sexual partner. That's the DSM language. It must either match or exceed the time and interest spent on their typical sexual behaviors. It must cause significant distress or impairment, and it must be present 6 months or longer. The disorders that I put the red asterisk next to are the ones in which it involves a person that's non-consenting. So exhibitionist, voyeuristic, frauderistic, pedophilic, and sexual sadistic, it must involve a non-consenting individual. For the other ones, fetishistic disorder, which you might call fetishism, masochistic disorder, which you probably would call masochism, transvestic disorder, which you would probably call transvestism, it only rises to the level of a paraphilia when the person is significantly distressed or it's causing impairment in their life. If they're not significantly distressed and it's not causing impairment in life areas, it would not be considered to be a paraphilia. Before you listen to the rest of this narration, you might enjoy going to the next slide and seeing which of these disorders you can already identify. So go ahead and do it, and then when you're done, come back and you'll see how many you were correct on and how many you are familiar with. So a person with exhibitionist disorder, or in other words, an exhibitionist, would expose themselves to a person who is not expecting it and presumably doesn't want it. So you would not be considered to be an exhibitionist if you were in a place that this behavior was expected. For this behavior, often nicknamed the flasher, it conjures up for many of us images of a man on a street corner with a raincoat flashing people. Though I'm told by students it's more likely this person has a vehicle and drives around and stops, interacts with people a lot, maybe stopping to get directions a lot, maybe stopping to get fast food a lot, and the person, as they're interacting, realizes that this person is naked and quite possibly masturbating. So this would be the exhibitionist. Fetishistic disorder, or in other words, fetishism, this person is aroused by parts of the body that most people don't find arousing, or by objects. If you're trying to think of examples, feet and shoes would definitely be a source of interest. So the person, most of these disorders are male associated, but not all. So this person might get himself a job so he can be around women's feet or shoes, for example. Or he might not even need a whole woman, he just might want the shoe itself, of course a worn shoe, a used shoe. For voyeuristic disorder, can you think of a nickname? The peeping Tom. So Lady Godiva, a real historical figure, was trying to champion the oppressed people of the village, and she brokered a deal. If she would ride naked through the town, the local nobility would stop oppressing the people. She agreed to it, but asked all the townspeople to shutter their windows and not look out. And everybody did that except for Tom. So a voyeur is a peeping Tom. So this is one of the most common of the paraphilias. Nowadays, it often uses technology. I'm sure you've heard stories about cameras being found in dressing rooms, in locker rooms, and hotel rooms. About every year or two, there'll be a story too about a local finding of this. So again, one of the very most common of these paraphilias. Frauderism, or frauderistic disorder, probably one that you haven't heard of, shown in the picture. This person rubs up against non-consenting strangers. So they're typically fans of mass transportation, particularly crowded mass transportation, like crowded subways, crowded buses, crowded bars, and they make the condition a lot more crowded than it needs to be. So this person would be a frauderist. Pedophilic disorder, of course, this person is the pedophile. A child can never get consent. It is any sexual interaction with a child or minor. It could be viewing of pornographic material, showing them pornographic videos, or physical interactions. So anything sexual with a child or non-consenting individual. Sexual sadistic disorder. This is a little different than the standard sadism and masochism. To be a sexual sadistic disorder, the person has to be non-consenting. So the person that they're degrading, humiliating, whatever, cannot be consenting. If it's a consenting S&M play between individuals, it does not qualify as a paraphilia. So again, this has got about the non-consent. Now for masochistic disorder, again, this is only disorder if the person is significantly distressed or it causes significant life impairment. So this person likes to be disciplined. They like to be sexually punished. So in S&M, they are the M of the S&M. And apparently many people will do both roles depending on the context and situation. Transvestic disorder, or known as transvestite, not to get confused with transsexual. This person, usually a male, gets aroused when he dresses in the clothing of an opposite sex, in other words, a woman. He virtually never would go in public. If he's got a partner, she's often clueless as to this is going on. He's almost always a heterosexual male. And I always joke with women, or half joke, if your fine lingerie are stretched out and you swear you take care of them properly, maybe there's a transvestite in your life. And there's many, many other paraphilias. These are the only ones that are listed by name in the DSM-5 TR, but there are many other ones, and they would go into the category of other specified paraphilic disorder. So this is a list that would reflect the DSM coverage. So starting at the top left and moving across the page, the top left image is for S&M, sadism and masochism. The man flashing somebody is a flasher, in other words, an exhibitionist. The child, of course, relates to pedophilia. The picture of the shoes would reflect maybe a person's interest in fetishism. The man or woman, for that matter, peeping through the peephole, that would be a peeping Tom. So that would be a voyeur. The next image we saw before, reflecting frauderism. And picture from Rocky Horror, you might know the song, Sweet Transvestite from Transylvania. So for a picture for transvestism. We're now ready to move on to our third topic of this chapter, gender dysphoria. But before we cover gender dysphoria, we need to do a little background information, make sure we're all on the same page. So let's consider the terms sex and gender. Sex, whether one's male or female or perhaps intersexed, it's a biological classification usually made easily and very quickly at birth. Now gender, on the other hand, whether you view yourself as a man, as a woman, or some other particular gender, it's a social classification, and with it goes expectations regarding to how that person is psychologically and what behaviors they maybe should or should not do. From gender, related topic, gender identity, your personal sense if you are a man or if you're a woman, or that you don't prefer that term and you use maybe a different term. So in support of our coverage of gender dysphoria, let's look at the term transgender and cis. The term transgender, or sometimes trans, is used when one's experienced gender does not match the gender that you were assigned at birth. So there's a mismatch. The term cisgender, often referred to just as cis, is used when there is a matching that your assigned sex at birth does match your gender. Now, trans folk are embraced in many societies and, unfortunately, met with violence in others, such in the U.S. Now, the middle picture of trans people I chose because they're fellow educators. On the left, showing trans people of India. They are legally recognized third gender. And the right, a picture of two Native American two-spirits. Although most people are cisgendered, their sex assigned at birth and their gender identity are matching, not everybody is cisgendered. We should become familiar with terms for people that are transgender, or we might call them gender nonconforming. So take a moment and see what terms come to mind. Of course, trans and transgender. Some people prefer the term gender fluid or agender. Some people prefer gender queer or gender creative. Or some people prefer gender fuck. Yes, I did say that. Some people are non-binary. Others are gender non-conforming. Some people go with the term third gender or non-gendered or genderless. So whatever term the person prefers is the term that you should use for them. Although most people are cisgendered, their sex assigned at birth and their gender identity are matching, not everybody is cisgendered. We should become familiar with terms for people that are transgender, or we might call them gender nonconforming. So take a moment and see what terms come to mind. Of course, trans and transgender. Some people prefer the term gender fluid or agender. Some people prefer gender queer or gender creative. Or some people prefer gender fuck. Yes, I did say that. Some people are non-binary. Others are gender non-conforming. Some people go with the term third gender or non-gendered or genderless. So whatever term the person prefers is the term that you should use for them. The idea of third gender or trans is a newer idea in Western culture, and many older adults, and in fact younger adults, have a hard time wrapping their heads around the concept. But worldwide, many cultures are very comfortable with the third gender and trans phenomena, and it's part of their culture. This slide is just giving you a partial list. So picture on the right would be a trans Taiwanese boxer. Over 130 different Native American tribes recognize two spirits or third gender people. Also the Hijira of India, Pakistan, and Bangladesh. Also Ethiopia, Kenya, Congo, Oman, Mexico, British Columbia, Guam, Hawaii, Balkans, Philippines, and Indonesia. And I could have easily kept going, but just wanted to give you an idea that it's not a rare phenomenon to accept and to be comfortable with trans and third gender. It's almost the opposite of not recognizing is worldwide more of the exception rather than the rule. And no, don't put any time trying to memorize these terms. You won't be tested on who goes with what society. So now we've briefly considered the topic of sex and gender and gender identity and trans and cisgender. And perhaps you were perfectly fluent in those concepts to begin with, or perhaps you need a little bit to understand the next topic. Since our course is focused on mental disorders, let's see how trans relate to this. First and foremost, being trans is not a disorder, is not a mental health condition. It is only a mental health condition when the person has gender dysphoria, which is severe distress due to the mismatch between the assigned sex at birth and the gender that they experience. The treatment would be helping the person move towards their desired sex.